This presentation is taken from your Understanding Procedural Coding work text, Chapter 13, and we're going to cover Chapter 14. Chapter 13 is on your male genital system. Chapter 14 is on your female genital system. So we're going to look at codes and procedures in these two systems. In your male genital system, this is going to include your penis, the testes, epididymis, tunica vaginalis, scrotum, vas deferens, spermatic cord, seminal vesicles, and prostate. One thing you need to pay close attention to when you are coding within this section is to make sure or understand whether you are reporting a service that's going to be performed as part of the urinary system, or shall it be in the male genital system, or even the female genital system. So you have to review both sections to be sure that you are making the proper code selection. You have to pay attention to your coding descriptions as well, in terms of whether it's a unilateral or bilateral procedure. If it does not specify, then you're going to assume it's unilateral, and if they are performing the procedure in actuality on both sides, then you will have to append your modifier 50 to that. Now, under your male genital system, if you will turn in your coding manual, it follows your section on the urinary system. It will be the next section of coding, starting with code 54000. If you could flip to that within your coding manual and kind of follow along in your coding manual as well as in your textbook to kind of verify that those things they're talking about, you can actually see them there. So that's always a good thing to do. So your code range starts with 54000 for your male genital system, and it goes all the way to 55899. Your first section of code starts with the penis, and you have incision procedures. There you see procedures for slitting of the prepuce. You see it for newborns, and then those that are not newborns, and then you also have incision and drainage coding here. You need to make sure, now that I'm talking about the descriptors, that you understand the terminology. Again, you need to refresh yourself, A&P med term, to assist you with this. After your incision procedure codes for the penis, you go to your destruction code, and in your destruction code, you see destruction of lesions, and they have the different types of ways that destruction can occur: cryo surgery, laser surgery, so forth, in that section. Then you go to your excision code. In your excision section, a common procedure will be for circumcisions. They are under excision. Typically, they're going to be performed on your infants, but you also have codes for patients who are not infants as well, to take care of those. And usually, you have to have some kind of documentation in terms of medical necessity when they are not infants. You also have codes for biopsies in the excision section. Excising a plaque, amputation of the penis is also here in this section. Lysis of adhesions, repairs of incomplete circumcisions are also in this section. Following your excision section, you have a section on introduction code. You got injection procedures here. You also have a penile plethysmography. In your introduction section, you will also see, like in your 54200, That injection procedure is for your Peyronie disease, and basically this is where that erectile tissue that we call your corpora cavernosa becomes hardened, and so here's a procedure to assist with that in your introduction section. It can cause deformity, and so there's that procedure there. Your book talks about that. Then from there you have your repair codes, and with your repair codes you also see some other terminology being used here. You got your ureteroplasty in this section, and you got repairs for hypospadias in this section. Your hypospadias has to do with when that the ureter opening on the penis is not correctly located, and so we call that hypospadias. You also got codes in your repair section for when the penis has an abnormal curvature. If you look in here in your coding manual, you will also see codes under repair for removal of different of prostheses here. You also have shunts, and you got fistulations occurring under your repair codes. Following your section on repairs for the penis, you got one code here for your manipulation. That's your 54450, which is for foreskin manipulation, including liases of perpetual adhesions and stretching. One code. Now, after the penis, you got procedures on the testes, the testicles. And in this section, it begins with excision codes. You see biopsies here, of course, excision of lesions. You got orchiectomy here, and you can see right here, if you pay attention to 54522, 54530, you see your orchiectomy can be partial or radical. So you have to choose from those. Following your excisions, you have two codes for exploration of the testes. Repairs are next. You got a reduction code. You got your orchioplexies, which stand out here in your repair section. Sutures, insertions of prosthesis here, transplantations of the testes to the side. That's your 54680. Then it follows up with your laparoscopy code for your testes. Your book tells you that if you have a laparoscopic repair of a hernia that's performed at the same time as your orchiopexy, then you're going to have two repair codes. Now, following your coding on your testes, you have codes for your epididymis and tunica vaginalis. Very small section. You have one incision code here for aspiration of hydrocele. Remember, hydrocele is nothing but saying there's a collection of fluid there in that body area. Then you have two excision codes for excisions of a hydrocele. It can be unilateral or bilateral. You have one repair code in this section, 55060, for repair of the tunica vaginalis hydrocele. It tells you bottle type. Very short coding section here. Right after your tunica vaginalis, you have a small section for the scrotum, and you also have a small section for your vas deferens. Under your scrotum, you have incision coding For abscesses, drainage or abscesses, you also have an exploration code and a removal of a foreign body. So only 3 codes under your incision. Excision, resection of the scrotum, 1 code. You have 2 repair codes for scrotoplasty, simple or complicated. So straightforward there. After the scrotum, that's your vas deferens, 1 incision code for a vasotomy. You have an excision code for a vasectomy. And we're pretty familiar with a vasectomy. Introduction code for a vasotomy for vasograms. Vesiculograms are epididymograms. You have 1 repair code, which is a vasovasotomy, vasovasotherapy. 1 suture code, 55450 for ligation in your vas deferens. All right, not very much there. Spermatic cord, seminal vesicles are next. Again, very small sections. Under your spermatic cord, you have excision codes, excision of hydrocele, excision of lesions, and a varicocele. Excisions. You have 2 laparoscopy codes, and that makes up your spermatic cord procedure section. Seminal vesicles, very, very small. You got incision and excision. You got vesiculotomy and your incision. You have, with that, I think, you got excision following that. I'm sorry. That's your vesiculectomy. All right, and then you got excision of a cyst as well. So 2 codes for your excision. Now, those are a couple of short sections for a couple of structures here in the male genital system. From there, your next structure would be for your prostate gland. If I can get this to move. In your prostate gland section of coding, it begins with incision procedure codes. You got your biopsies here. You got your prostatotomies here as well. Under your incision codes, you need to pay attention as to whether they're using imaging guidance, because you will have to report that in addition to your procedure code. Excision section is next. You got your prostatectomies here. You have your, after your prostatectomies, you have exposure of prostate as well. When they're trying to place some radioactive substance within that area, you need to make sure you pay attention to how often that procedure is being done. You also need to make sure, verify whether you need any modifiers in that section. Now, in your prostate gland, you have one code for laparoscopy. That will be your 55866 for prostatectomy done in a laparoscopic method. You have other procedure codes, which would include electroejaculation, and with that procedure pretty much describes a method for them to stimulate ejaculation to collect semen. All right, and usually they're doing this for artificial insemination, but note that you're not coding your artificial insemination in this section. You're only coding the procedure for the electroejaculation. You also have ablation here, needle or catheter placement here, and placement of devices under your other procedure section for the prostate. After your other procedure, you see in green, there's one code here that falls under reproductive system procedures, 55920, placement of needles or catheters into pelvic organs and or genitalia for subsequent interstitial radio element application. That's the only code there, and you got a couple of notations that you need to pay attention to as well that direct you into other codes for different things that may occur here. The last section under your male genital system is for intersex surgery. So people who are undergoing a sex change operation. And you see it divided in two sections, 55970, male to female, and 55980, female to male. Now we're going to move from chapter 13, if you would please, to chapter 14. Very small section of codes. Chapter 14 covers your female genital system. Also flip over in your coding manual as well. It's the next one behind your male genital system. When we're looking at procedure codes for the female genital system, it includes structures of the vulva, the perineum, your introitus, your vagina, cervix, uteri, corpus uteri, and ovaries, uterus, and fallopian tubes. Okay, so you got to pay attention to your terminology and your anatomy here. And you, in both chapter 13 and 14, there are some good diagrams here in terms of location of these structures and what they are. So you might want to refresh on those. If you notice in your coding manual for your female genital system, it starts with a section on your vulva, perineum, and introitus. All right, 56405 is the first code. Falls under your incision section. So you got incision drainage for abscesses and cysts. You got lysis of labial adhesions that fall under your incision. You got hemanotomy as well. Following your incision, you have a destruction section for destruction of lesions. Okay, only two codes there. Then you go to your excision code. Your excision is where you're going to find your biopsies, your vulvectomy codes. And with the vulvectomy codes on your excision section, if you looked at the very beginning of your vulval, perineum, and introitus section, there were some definitions that apply to your vulvectomy. You got your simple, it's a simple vulvectomy, which is the removal of skin and superficial subcutaneous tissue of your vulva. You got a radical procedure, which is the removal of skin and deep subcutaneous tissue. Then you got partial and complete. Partial procedure is the removal of less than 80% of the vulvar area, and a complete procedure is the removal of greater than 80% of the vulvar area. These are going to apply to your vulvectomies, and if you look, starting there 56620, and then a couple more codes down, you see the use of those terminologies: simple, radical, partial, and complete. So you need to pay attention to those so you will know how to code that section correctly. Under excision, you also have hymenectomies and incisions of cysts as well that fall under this section. After your excision, you got repair codes. You got your clitoroplasties, your perineoplasties, and your plastic repair via introitus. Okay? Endoscopic procedures, you got 2 endoscopy codes for your vulval perineum and introitus. After that section, and under that endoscopy, that's where your colposcopy is. Now, after that section of coding, then it takes you to a different structure, which is the vagina. It starts off with code 57000, and that falls under your incision section. You got your colpotomy and your colpocentesis, and your incision drainage or hematomas are here. You have 2 codes that make up your destruction section for destruction of lesions within the vagina. You got excision codes here. You got your biopsies. You got vaginectomy here. And you got your colpoclesis procedures here. And under that colpoclesis, it tells you Lee Fort type. Alright, so it gives you a type just in case you see that in your notation or your documentation. When you are coding, you got incision of your vaginal septum and cyst and tumor incisions. Introduction section for your vagina, you got irrigation procedures, you have insertions, and fitting and insertion of pessary. You got your diaphragm or cervical cap fitting, introduction of hemostatic agents, all falling under your introduction section. Repairs, your colporal orifices are here. Your colporal perineal orifice, plastic operation on a urethral sphincter, urethral seal repair, colpopexy, repair of enteroseals. Alright? Removal or revision of a sling. So you have sling procedures falling under your repairs for your vagina. You got closures, fistula closures as well, and you got your vaginoplasties. From there you have a manipulation code where you got dilations going on and removal of foreign bodies for your vagina. There's only 3 codes there. That it follows up with your endoscopy and laparoscopy codes. And that closes out your section of coding for your vagina. Your cervix uteri, not a very big section. Under this section, you have your endoscopy code, and then after that's your colposcopy of the cervix in that section. That comes right before your excision code. And then your incision codes for your cervix uteri will be your biopsies. You got curettages. In here you got colonization, cauteries, excision of cervical stump, all located in your excision section. Tracheolectomies, that's your removal of your cervix uteri. That's also there. You only have 2 repair codes. Circulage of your uterine cervix and your tracheal orifice. Your book tells you in terms of just something you need to note when we're looking at that circulage code, and that this is not the code you would use if it was an obstetric situation where they're trying to prevent a spontaneous abortion. So this is not the code for that. So that's something important to note. From there, you have one manipulation code, which is a dilation code. 57800. Now, after your cervix uteri, you have your corpus uteri procedures. It starts off with excision codes. In this section, you'll see some endometrium procedures. For example, your endometrial sampling procedures is here. You have a myomectomy here, and also under your corpus uteri, if you flip over, you have hysterectomy procedures. That's a very common procedure, and you can note here when you're looking at here, you have two different approaches. You can have an abdominal hysterectomy, or you can have a vaginal hysterectomy. Okay. Now, after your excision, you have an introduction section where you're inserting and removing devices, like your IUDs, your intrauterine devices, your Hymen capsules. You have endometrial ablation occurring under your introduction section. That follows up with your repair codes. You have 4 here. Your uterine suspension codes. You got hysterography, hysteroplasty under your repair. After repair, you have your laparoscopy and your hysteroscopy. That should be pretty straightforward. And that will complete your corpus uteri procedure codes. After that, you have a section for your oviduct and ovaries. It starts with incision codes. So when we're talking about your oviduct or ovaries, fallopian tubes, that's what we're talking about. Your incision codes start here. You got ligation for your fallopian tubes, occlusion of fallopian tubes by device, all in your incision section. Next section is laparoscopy for your oviduct and ovaries. You got 2 excision codes here for salpingectomy and a salpingo-oophorectomy. That should ring a bell with your med term. You got repair codes for lysis of adhesions. You got anastomosis, implantations, fimbrioplasties, salpingostomies, all in your repair codes. So those are your oviduct ovaries, but then you have a section just for the ovary itself. And in this section, you got incisions for ovarian cysts and ovarian abscesses. Then you got excision codes, biopsy of your ovaries, wedge resections of your ovaries, oophorectomies, partial, total, resection. Laparotomies, all under that, all under your excision codes for the ovary. Now, the last section in your female genital section is for in vitro fertilization. And when we're looking at your in vitro fertilization procedure, you have 3 codes there, and you're reporting the retrieval of the egg, the placement of that fertilized egg in the uterus, the gamete intrafallopian transfer, which is GIST, and then your zygote intrafallopian transfer, which is your ZIFT procedure. And then you have under your other procedure section only 1 code, which is your unlisted procedure for your female genital section, 58999. Okay, this is going to conclude my presentation on your male and female genital systems.